What patient safety protocols protect during intubation? Intubation is a vital step in many plastic surgery procedures that requiring general anesthesia, especially when working on the face, neck, or airway. Ensuring patient safety during this process involves a series of carefully followed, evidence-based protocols designed to minimize risks and handle any complications effectively. These protocols are essential because they help protect patients from airway injuries, oxygen deprivation, or other serious issues during surgery. Before intubation begins, the medical team conducts a thorough airway assessment. This includes reviewing the patient's medical history, examining their facial and neck anatomy, and checking for factors that could make intubation more difficult. For example, limited jaw movement, previous facial surgeries, or the presence of dental issues are carefully evaluated. In plastic surgery, special attention is paid to any cosmetic enhancements like piercings or implants that could interfere with airway management. The team also ensures all necessary equipment is ready and functioning properly. This includes having different sizes of endotracheal tubes, various laryngoscope blades, and backup devices such as video laryngoscopes or fiber optic scopes. Suction devices are kept nearby to clear the airway if needed. For patients at higher risk of aspiration, such as those with full stomachs or certain medical conditions, rapid sequence induction is often used. This technique involves administering anesthesia quickly to minimize the time the airway is unprotected, reducing the chance of stomach contents entering the lungs. During the actual intubation, continuous monitoring is crucial. The anesthesia team keeps a close eye on vital signs like oxygen saturation, heart rate, and blood pressure. Capnography, which measures exhaled carbon dioxide, is used to confirm that the tube is correctly placed in the windpipe and to detect any disconnection or obstruction early. The choice of airway device depends on the procedure. For surgeries not involving the face or where head movement is minimal, a laryngeal mask airway may be used as an alternative to traditional endotracheal tubes. These devices can reduce the risk of vocal cord injury and postoperative sore throat. However, for procedures involving the face or when there is a risk of aspiration, an endotracheal tube is preferred because it provides a more secure airway. In plastic surgery, the tube is often secured in a way that maintains sterility and does not interfere with the surgical field. Sometimes, techniques like submental intubation are used, where the tube is routed through a small incision under the chin to keep it out of the way of the surgeon. Once the airway is secured, ongoing vigilance remains important. The anesthesia team regularly checks for signs of tube displacement, kinking, or disconnection, especially if the patient's head is repositioned during surgery. They listen for breath sounds and monitor end-tidal carbon dioxide levels to ensure the tube stays correctly placed. Eye protection is also a key safety measure. Eyelids are taped shut and lubricated to prevent corneal abrasions, especially in facial procedures. Infection control is another critical aspect. All equipment must be sterile, and the surgical team follows strict hand hygiene and personal protective equipment protocols. The operating room environment is maintained at high cleanliness standards to reduce the risk of postoperative infections. Despite all precautions, complications can sometimes occur. That is why emergency airway equipment and medications are always ready and accessible. The team must be trained to recognize and manage issues like difficult intubation, airway obstruction, or accidental extubation. In rare cases, alternative methods such as fiber optic intubation or surgical airway access, like a tracheostomy, may be necessary. Additional considerations in plastic surgery include the impact of previous cosmetic procedures or enhancements, which can alter anatomy or pose unique risks during airway management. For example, facial fillers or implants might affect the airway or complicate intubation, so these factors are carefully assessed beforehand. Patient safety during intubation is a team effort that involves clear communication, meticulous documentation, and a culture of safety that prioritizes the patient's well-being. Informed consent is obtained before surgery, and patients are educated about the risks and benefits of anesthesia and airway management. In summary, protecting patients during intubation involves thorough preoperative assessment, proper equipment preparation, continuous monitoring, strict infection control, readiness for emergencies, and a patient-centered approach. These protocols are designed to prevent harm and promote the best possible outcomes, reflecting the high standards of safety in modern plastic surgery. Always remember to consult qualified healthcare professionals for personalized advice and care.